Okay. Let's start. Start now.
Yes, sir.
Okay.
Yes, sir.
Hello, everyone. Good evening for all of you. Today, we will continue our revision, our free revision, with the second revision lecture. We will discuss, as usual, about 20 questions from previous exams. We will see the rationale of the answer and different questions that may come, like the questions distributed. Okay. I will make all of you mute. You can ask at any time. If you have any question, please raise your hand and open your mic and ask. Okay. So let's start with the first question today. The precursor for serotonin is amino acid. This question is repeated many times previously. Okay. Also, another one related to the precursor of histamine. Many of the neurotransmitters in our body, or some other substances in our body are synthesized from a certain amino acids. So here, serotonin, which contain indole ring, the precursor of it is an amino acid containing also indole ring, which is tryptophan. Okay. While a neurotransmitter like histamine, what is the amino acid that is precursor for it? It is
Histidine.
histidine. Yes, histidine amino acid. Okay. About phenylalanine. Phenylalanine, does it precursor for any neurotransmitter? It's not direct.
Epinephrine.
Yes, but not directly. But not directly. It is a precursor, or this phenylalanine will convert it into tyrosine. Not tyramine, I'm sorry. It is tyrosine. This tyrosine amino acid is the direct precursor for epinephrine and norepinephrine. Okay. Let us see the next question. Which of the following drugs specifically inhibits calcineurin in the activated T lymphocytes?
Tacrolimus.
Yes, the answer is tacrolimus or cyclosporin, if cyclosporin present. Both having the same mechanism. What is this mechanism? The immunosuppressants, especially used for the organ transplantation, depends on the deactivation of T lymphocytes, T cells, which is responsible for the activation of the immune system. So when you deactivate or prevent T cells from its action, what will happen? You will inhibit the immune system. Calcineurin is a substance that increase or activate the T cells. Okay, so it will activate the T cells. So when you inhibit this calcineurin, you will inhibit the T lymphocytes. This is the action and the mechanism of action of tacrolimus and cyclosporin as well. Okay, let us see the next one.
Yes, sir.
What is the active product of marijuana? Here, the structure of tetrahydrocannabinol. Also, this one repeated many times previously. What is the active product of marijuana? It is tetrahydrocannabinol. It's one of the cannabinoids, not codeine, not heroin, not morphine. Those are opioids.
Is the isomer form?
Okay, please make the mic mute to avoid the interruption. Let us see the next one about a calculation. This one related to the dilution. Let us see how can we solve a question like this. Here we have an ampoule. Its volume is 20 milliliter of with a concentration of 0.75%. We need to prepare 250 milliliter solution with a concentration of 0.125%. What is the volume of the liquid from this ampoule? If we need one ampoule or more than one ampoule, finally, we need to know how many milliliter can be taken from this type of ampoules to prepare the new concentration. So here we have a dilution. We have a concentration before, which is 0.75%. We have a concentration after, which is 0.125%. We have the volume after. So directly we can use C multiplied by V before equals C multiplied by V after to solve this question. But before using this formula, you should do something. You should check the units. Both sides should have the similar units. So the percentage here of concentration before, 0.75, and the other side is 0.125%. So there is no problem in the unit. About the volume after is 250 milliliters, and the before is needed, the volume before needed by milliliter. So directly using the formula to get the answer, which is 42 milliliters. It's a very easy and direct question. Okay? If he asks about how many ampoules can be used, and the answer 1, 2, 3, and 4. What is your answer in this case?
Sir, more than 2 means 42 ml, so
3.
3 ampoules.
3. Yes, this is the right answer in this case. 3. Because here we need 42 ml, which is more than the amount of 2 ampoules. So we need extra amount to give or to have the right concentration. Okay? Let us see another one.
Yes, sir.
Another question about the stereochemistry. The enantiomers, diacetylamers, mesocompound, and isomers, and so on. Here, we have 4 isomers of the compound which is called 2-chloro-3-nitrobutane. 2-chloro-3-nitrobutane. The isomer A in relation to isomer C. What is the relation between those 2 isomers? In order to know the relation, let us put it beside each other to see the characters of both. Here we will draw number A, here CH3, and here CH3, here H, here NO2, here H, and here Cl. Okay? And the other one, or the number C, CH3, here Cl, here H, here H, and NO2 and CH3. Firstly, or first step, knowing the number of chiral centers. Does those isomers contain chiral centers or no? For sure, yes. How many chiral centers? This is the first, and this is the second. 2 chiral centers. Okay, 2 chiral centers. The second step, are they mirror image to each other or not? Let us see. Here, the Cl is not mirror image to Cl in the same side, while here NO2 is mirror image to NO2. So the final result is not mirror image. Not mirror image. Okay? The third character that we should know. Are they superimposed or not? What is the meaning of superimposed? If you put one of them over the other, are they compatible or not? If compatible means they are superimposed. If you put A over C or the opposite, Cl over Cl. But here you will find that NO2 not over the NO2. So it is not superimposed. Okay, not superimposed. The last character, the optical activity. Does those isomers having optical activity or not? How can we know that? We have 2 rules about that. The first rule, if number of chiral center is odd number, 1, 3, 5, 7, directly the compound here is optically active. Okay? If the number of chiral centers are odd number, directly the compound here is optically active. While if number of chiral center, like this case, even number of chiral centers, even number 2, 4, 6, 8, and so on. Here we have 2. This is our case. You should check if the compound is mesocompound or not. If it is mesocompound, this means that it is not optically active. So here it is not either enantiomer or diastereomer. Okay, but here, let us see the case here. How can we know if it is meso or not? Divide the compound into 2 equal halves from the middle. The upper and the lower side. And then bend the upper over the lower. If they are superimposed, is it mesocompound? It is mesocompound. If it is not superimposed, it is not mesocompound. Here you will find the CH3 over the CH3, while here the Cl over H. So it's not a meso, it's not a mirror image. So it is not meso. Therefore, it is optically active. Okay, it is optically active. So the optical activity is present in the 4 characters. Optically active. What does this mean? We have 4 characters here. 2 chiral centers, not mirror image to each other, not superimposed, and optically active. Directly, they are diastereomers. They are diastereomers. While if they are mirror image to each other, like the case of A and B, if you compare A and B, they are mirror image to each other and not superimposed. So A and B are enantiomers, while A and C, they are diastereomers. Okay, is it clear? Does anyone have any question about the isomers or enantiomers, diastereomers?
Sir, how much time for each question means do we have sufficient time to solve these questions like this?
Yes. 1 to 1.5 minutes maximum. We have 100 questions per paper. For what is the time? 120 minutes. This makes that the question should be solved within 1 to 1.5 maximum. Okay, but I take my time here because I'm explaining, but you should do it very fastly.
Okay.
Another question.
Yeah, I wanted to ask. I
Yes.
wanted to ask a question.
Yes, please.
How can I know the compound is optically active or not again, please?
Okay. Here to know the optical activity or not. First character that the compound should be called optically active is the presence of chiral centers. If there is chiral centers, it is maybe optically active or not. Here we have 2 optical centers or 2 chiral centers. The second step, check is it mesocompound or not. If it is mesocompound, it is not optically active. So we have 2 rules. The first rule, if we have an odd number of chiral centers, like if we have 1 chiral center or 3 chiral centers or 5 and so on, directly the compound is optically active. There is no need for checking if it is mesocompound or not. Okay? While if we have even number, like our case here, we have 2 chiral centers, 2, 4, 6, and so on. In this case, see the compound if the upper part is mirror image to lower part or not. If it is, so the compound is mesocompound, like the following case: COOH, COOH. Okay. We'll here now. And here we have OH here and OH here. This is the tartaric acid. Okay. What about this tartaric acid? You'll find that we have 2 chiral centers. And if you divide the compound into 2 equal halves, the upper part similar to the lower part, mirror image to the lower part. So this compound is a mesocompound and optically inactive. So we will not find either enantiomer or diastereomer for this structure, not for tartaric acid as a general, but for this structure or this shape of the structure. Is it clear? Yes, mirror image equal enantiomers, not mirror image equal diastereomers if the other characters are the same. Okay, but for diastereomers, also another difference between diastereomers and enantiomers, the number of chiral centers. Enantiomers can be defined if the chiral centers starting from 1. Okay, so 1, 2, 3. While diastereomers, to be diastereomers, the number of chiral centers at least should be 2. Okay, if it is 1, it will not be diastereomers. Let us see this question. The type of radiation used in sterilization. It is gamma radiation. It is the most popular form of radiation sterilization or used in sterilization. Okay, we use it when the materials are sensitive to high temperature for autoclaving. Okay, but the material should be compatible with the ionizing radiation. So this is the gamma radiation. What is the HPLC? HPLC is an abbreviation for high performance liquid chromatography. High performance liquid chromatography. Okay, HPLC. In the last exam, they asked about a certain substances and asked if it is mobile stage or stationary phase. Any chromatography formed of two phases, mobile phase and stationary phase. Okay. And the analyte. The analyte is the substance that you should or you want to analyze it. Called analyte. The analyte moved with the mobile phase through the stationary phase. The main idea here is that the stationary phase have the ability to absorb or stop the motility of the analyte at certain point. So if we have 2 or 3 substances moved with the mobile phase through the stationary phase will stop the substance number 1 at this point, will stop the substance number 2 at this point. Okay. So here we have a method for separation between substances or knowing the identity of the substance. So the chromatography is a method for analysis of the qualitative, mainly qualitative analysis. But some types of chromatography also help us to know the concentration. Okay. Yes, regarding to differences in solubility or differences in absorption, many factors. So some types of chromatography help us to know the quality only, and some helps us to know the quality and the quantity. One of the qualitative and quantitative analysis for chromatography is the HPLC, because it will give us a chart like this, containing the distance. The distance gives us the quality, which substance appear at this distance, while the intensity of the peak gives us an idea about the concentration of the substance. Span and tween. What are those substances? They are non-ionic surfactants. They are non-ionic surfactants. Okay? Both of them, the chemical structure of them formed of polyoxyalkylene derivatives. Polyoxyalkylene derivatives, yes. Span is lipophilic, while tween is hydrophilic. In the HLP system, you'll find spans, different spans in the lower part, so that they will form water in oil emulsion, yes. While tween is hydrophilic, present its value or HLP value present in the upper part of the HLP system, so it will form oil in water emulsion. If you use the opposite surfactant, you will make a separation between phases and you will destroy the emulsion. A question about the sequence of the blood flow in the circulation. Okay, so you should know the circulation very well. Let us revise it. Firstly, here we have the heart, 2 atria, 2 ventricles. Okay. The blood coming from the body through the vena cava, superior and inferior vena cava, to the right atrium, then through the tricuspid valve to the right ventricle, then the pulmonary artery, to the lungs in order for oxygenation, then going back to the heart through the pulmonary veins for pulmonary veins to the left atrium, then through the mitral valve to left ventricle, then through aorta to other parts of the body. Okay, here. Let us see the sequences and decide which one is the right. Left ventricle to aorta. Okay. Then from aorta to carotid artery. Okay. Then to the cerebral, to the brain. Yes, this is the right sequence. While others are wrong. From the right ventricle to aorta, it is not right sequence. From the left ventricle to aorta, okay. But from aorta to pulmonary artery, no, it is wrong. Right ventricle to aorta, also it is wrong. One of the biggest questions repeated many times previously. Not a method for contamination. Sometimes this question is a confusing. Why? What about this contamination? Contamination of what? It's not clear. But actually they are asking about the contamination of powders with impurities, not the infectious disease or contamination with bacteria or other organisms. It is the presence of impurities in powders in the pharmaceutical synthesis. Okay, we have 4 mechanisms of contamination of the powders: inclusion, precipitation, and occlusion. The 4th one is the adsorption, surface adsorption. Okay, while exclusion is not a method for contamination. So the answer of this question is exclusion. How many optical isomers are possible for 2-amino propanoic acids? How can you know that? The first step of knowing that is knowing how many chiral centers. How many chiral centers? Then use the following formula. The number of optical isomers equal 2 to the power n. The n here is the number of the chiral centers. So how many chiral centers here? Here, this carbon is not chiral. Any carbon containing double bond, it is not chiral. Okay? While this carbon, let's see the groups surrounding this carbon. This is the first group, carboxylic group, amino group, methyl group, and the 4th one is H. So we have 4 different groups. So this is a chiral center. Till now we have 1. Any of those carbons are not chiral centers. So we have 1 chiral center. Therefore, 2 to the power n equal 2. And this compound or this amino acid is the we're having 2 optical isomers. A question regarding to the comparison between the strength of or the acidity of the carboxylic acid. To compare the acidity, we need to know the types of groups attached to the carboxylic group. Is it electron donating or electron withdrawing? Electron donating decrease the acidity. while if there is an electron withdrawing group, will increase the acidity. Electron donating like what? Like alkyl groups. Electron withdrawing like what? Like halides, oxygen, nitrogen, sulfur, and so on. Those will increase the acidity of the carboxylic acid. Even aromatic ring also. Aromatic ring. CH3, COOH, it is acetic acid in comparison to formic acid. Okay. But here we have chloro or trichloroacetic acid. So here we have a withdrawing group. So we can exclude both acetic and formic because we have another one containing withdrawing group. Yes, aromatic ring will increase the acidity. Bromo or dibromoacetic acid. Also, we have an electron withdrawing group. So we will compare between both this one and this one. And one of them will be the most strongest one or the strongest one. Here we have 3 chloride atoms and here we have two bromide atoms. So that directly the 3 chloride atoms will increase the acidity. So the answer here is C. What will happen if we have only 2 chloride atoms like the following? Cl2, CH, COOH. By the way, this is not 2. Okay? It's like Br2CH, COOH. Which of them is more acidic? The compound containing chloride or bromide?
Chloride.
Chloride. Yes. Because of the electronegativity. Is the electronegativity of chloride more than bromide, making the chloride more acidic than bromide.
So what about fluoride?
Fluoride also more acidic than chloride. This is the order of the electronegativity. Fluoride, chloride, bromide, and then iodide.
Sir, if tribromide is there, means number of bromide is increased, then it will be the right answer.
If the bromide are 3 atoms and chloride are 2 atoms, then the bromide will be more acidic. Here, the number of atoms of withdrawing more than the other compound. But if they are similar, like this example, Cl2 and Br2, then choose the chloride. Is it clear?
Yes, sir.
Okay. If they ask about the stability of alkyl halide, if we have, for example, this compound CH3F, CH3Cl, CH3Br, and CH3I, which is more stable?
CH3.
Yes, the iodide.
CH3I.
Yes,
That's
the
true.
size will increase the stability. Okay, the size here will increase the stability. So the bigger size is iodine. Fluoride, chloride, bromide, and the iodide is the bigger one. Let us see this
So,
one
sir,
about calculation. Yes, please.
the electron donating group will be mostly hydrogen and methyl group, is it?
Lactone group. Lactone group is a type of ester. This is one type of lactone containing oxygen inside the ring and the adjacent carbon having double bond O. Even it is 5-membered like what I drew, or sometimes 6-membered ring. Okay, but the main character is the presence of oxygen and the adjacent carbon containing double bond O. This is a lactone ring. Okay. Let us see the next one. One of the calculation questions. A patient brings you a prescription for 16 milliequivalents of potassium chloride. Your pharmacy has 600 milligram potassium chloride tablets or controlled release tablets. Here he gives you the molecular weight of the potassium chloride. How many tablets you need to fill this prescription? How can we know that? We need to know the 16 milliequivalence means how many milligrams. By which formula? The formula saying that milliequivalence equal weight in milligram over molecular weight over the small n. What is the small n? The small n is the valency of the positive ion multiplied by its number in the molecule. So here we have potassium chloride. The positive ion is chloride. Its valency is 1. And how many potassium? We have only 1 potassium. So the small n here equal 1. Just multiply, transfer this to the other side, to the other side, so that the weight equal the milliequivalence, which is 16, multiplied by the molecular weight, which is 74.5. What is the result in this case? 16 multiplied by 74.5 equal 1,192 milligrams. So this tablet contain, or not the tablet, this prescription needs about 1,200 milligrams of potassium chloride. Each tablet containing 600 milligrams. So how many tablets? Likely it will be 2 tablets. Okay? Do you have any problem with this type of questions? What is that transferrin? Transferrin is the transporter of the iron, the protein that carry the iron in the blood. Okay?
Sir, last question, you said that valency. So sometimes we don't, we forget a number of valencies for some compounds. So is there any specific questions or elements that we have to remember, sir? Yeah, in this question.
Do you know the valency of the positive ions like sodium, potassium, calcium, magnesium, zinc, aluminium, lithium?
Okay.
Do you know them or not?
Yeah, sir, sometime I got confused in valency. So that's why, is there any specific, you know, in past experience, is there any specific elements which we have to remember, or it's sometimes
the common elements. The common elements you should remember them: sodium, potassium, calcium, magnesium, zinc, okay, lithium. What else? Aluminium. All of them are common, and you can know them from the periodic table. Okay? Sodium is 1, potassium 1, lithium is 1, calcium is 2, magnesium 2, zinc 2, aluminium 3.
Yeah.
Okay. Those are the common.
Thank you. Yeah, that's what I want to ask, that if we remember the common ones, it will be enough for the exam.
Yes, sir.
Okay. Thank you so much.
Transferrin is the protein that carry the iron in the blood. What is the storage of iron in the blood? It is called ferritin. Yes, ferritin is the storage of the iron in the blood. Indicated in esophageal ulcer by driving acidity away from the ulcer. Here we have a specific mechanism. This mechanism means that the drug will form like a membrane or a layer over the ulcer, so that separate between the acidity and the ulcer. It is sucralfate. It is sucralfate. Okay. Sucralfate here will do what? Will combined with HCl to form a layer. It will interact with HCl to form a layer. This layer will protect against the acidity in the stomach. Okay.
But here, many of pharmacists in KAPS group, they said metoclopramide, not sucralfate.
Metoclopramide do not do that at all.
There are being
It's
acidity. Sucralfate make a layer.
Sucralfate is insulate the mucus layer.
Yes. Metoclopramide, what is the action of metoclopramide? It is increasing the motility of the GIT, anti-emetic agent, prokinetic. Okay, what is the relation between metoclopramide and the acidity? What it will do? Here, sucralfate doing what? Sucralfate in presence of HCl, it will form a layer. This layer will protect the wall of the stomach. Okay? So, you should not use sucralfate with antacids or H2 blockers or PPIs at the same time. Why?
They
In this
reduce
case, yes, they will reduce the acidity. Already they will reduce the acidity, they will reduce the HCl. Sucralfate acts only when there is HCl. It needs HCl to work. And if there is no HCl or a little HCl, it will not work. Okay? Highest capacity of pulmonary volume. What is this application or term means? Or what is the term of this definition? Highest capacity of pulmonary volume. Is it tidal volume or vital capacity or forced expiratory volume or residual volume? It is vital capacity. Vital capacity is the maximum amount of air that can be exhaled after maximum inhalation. Okay, it represents the total volume of air that a person can move in and out. This is the maximum or highest capacity of the lung. While tidal volume, what is the tidal volume? It is the normal volume of air inhaled and exhaled. The normal volume of air that inhaled or exhaled during breathing. While forced expiratory volume is the measurement of the amount of the air forcefully exhaled during the specific time, during 1 second or the first second. The residual volume is the volume that remains in the lung, inside the lung. Leukocytosis refers what? Leukocytosis, it is an increase in white blood cells. It's increase in the white blood cells. Which of the following is not metabolized by glucuronidation? As you know, we have 2 phases of metabolism. The phase 1, which contain 3 types of reactions: oxidation, reduction, and hydrolysis. And the oxidation is the main reaction of phase 1 metabolism. While phase 2 formed of the conjugation reactions. Conjugation reactions are 6 types according to the conjugate. Okay, glucuronidation. The conjugate here is glucuronic acid, joined or combined with the molecule to make it more polar in order to excretion. Sulfation. The sulfate group joined to the main drug in order to make it more polar for excretion. Acylation. Acylation here means either glycine or another amino acid will join to the main compound in order to make it more polar. So here we have amino acid conjugation or acylation. Glutathione conjugation with glutathione. Methylation is the addition of methyl group, or the final one is acetylation, is the addition of acetyl group. Glucuronic acid conjugate bind to which functional group? If the functional group is carboxylic group, OH, NH, or SH, all of them will bound to the glucuronic acid. So here we have different drugs: alkene, phenol, carboxylic acid, acetaminophen. All of them, glucuronic acid can join with it or can bind with it, except alkene. Alkene will not join to glucuronic acid. So any compound like those, or any drug like those, will have this type of metabolism, while the compound containing alkene only have no metabolism by this reaction.
Alkene will be metabolized by what reaction then?
According to the remaining part of the compound, this group will not metabolize, will not do a reaction. Okay, but the compound not only containing alkene group, it may contain another groups. So the metabolism may be from other groups. Yes.
Right.
Any other question?
Sir, I want to ask, just now, can you repeat this glucuronidation? What is the group that will bind to this glucuronic
For
acid?
glucuronic acid, it will bind to OH group, to COOH group, to NH, to SH. All of them will bind to glucuronic acid. Okay, so those groups, if present in any compound, it may go through the glucuronidation. Glucuronidation is the most common phase 2 reaction. The next one. The bioavailability of immediate dosage form depends on what? To increase the bioavailability, what do you need? Increase disintegration, dissolution, absorption, or diffusion. The first limiting step is dissolution. All of them will affect the bioavailability, but what is the first? It is dissolution. Dissolution, if the drug does not dissolve, it will not absorb. Okay.
So if it's enteric coated, depends on what?
If what? I'm sorry.
Enteric coated. If the drug is enteric coated.
If the drug is
Enteric coated.
Enteric coated.
Yes, if the drug is enteric coated, also dissolution.
Because
Also,
dissolution is the rate limiting step for absorption.
yes, the dissolution is the rate limiting step for absorption. So it is an important or the most important step for absorption.
So is there any formulation that the disintegration will be the rate limiting step?
Disintegration, the drug to be dissolved, it should be disintegrated. So the disintegration should happen for all types of tablets. But the rate limiting step is the dissolution. Okay? The enteric coated tablet have longer time to be disintegrated. Why? Because it should pass the stomach. So it will take a time for disintegration.
Some of the records says that the control release formulations have disintegration as a rate limiting step.
But after disintegration happened, what will happen to the drug? Is it absorbed directly or still waiting for dissolution?
Disintegration before dissolution, then absorption.
Yes.
I think.
Yes.
Actually,
Disintegration before, but does
actually
this...
disintegration is the rate limiting step for dissolution?
Wow. Because in the record states that disintegration is a rate limiting step for control release formulations.
Yes.
Modified release
That's what we remember, that disintegration is the rate limiting step for enteric coated tablets.
Oh,
Please.
okay.
Please. Take it
All right.
and step by step with me.
Is there any dosage form in which pH affects the bioavailability? And the
Disintegration.
pH rate?
Just a minute. Let us do this part. Disintegration. Does this disintegration happen for all types of tablets or not?
Yeah,
Yes.
happens.
Happen for all types of tablets. Okay? The disintegration time different according to the type of the coat or the type of the tablet. Okay? Does the disintegration, after disintegration, the drug absorbed directly or not?
No,
will not.
first we have to dissolve.
Firstly, it should be dissolved. So the dissolution should happen for all types, even enteric coated, even control release tablet, right?
Yes,
So
sir.
after even the disintegration will take a time, it needs another time for dissolve. So what is the direct rate limiting step for absorption? Is it disintegration or the dissolution?
Dissolution.
So the dissolution here is the answer. Okay, did you got it?
Sir, if in question they ask the bioavailability of enteric coated dosage form depends on, then we have to select the dissolution as well, isn't it?
Dissolution. Enteric coated, what is the purpose for enteric coat?
To bypass some areas of absorption, like
To not to
bypass.
bypass the absorption, not to bypass the absorption.
To avoid
by-
the
to avoid either to avoid the acidity of the stomach, because acidity
Yes.
of the stomach will destroy the drug, or to avoid the effect of the drug on the stomach, like drug like aspirin, for example. It is harmful for the stomach. So when we formulate it as enteric coated, we protect the stomach. Okay? While drug as omeprazole, it will be destroyed from the HCl of the stomach. So we protect the drug. So the enteric coated either to protect, both are the protect stomach from the drug or protect drug from the stomach. This is the purpose of enteric coated. So we need the enteric coated tablet to pass the stomach without disintegration, then start the disintegration in alkaline medium or less acidic medium in the duodenum. Then after this disintegration, the dissolution should take place in order for absorption. Is it clear?
Yes, sir. Thank you so much.
So meaning if this kind of question, whatever dosage for which is either capsule or tablet, it would depends on the dissolution, right? Oh no, I mean like only tablet, right? Capsule, it won't.
In my opinion, yes, the dissolution is the rate limiting step for absorption.
Is capsule undergo this dissolution as well?
Yes, as well as capsule. The releasing of the content of the capsule will take some time according to the formulation, but after the releasing of the content, it should dissolve, then absorb it.
So another question, which is about the bioavailability. Actually, it's very confusing because in our the KAPS group, they discuss about the bioavailability affected by the volume or distribution or not.
for sure it will not affect it. Which happened firstly, the absorption or the distribution?
Absorption.
Absorption. So how can the bioavailability affected by distribution? It's not logic. Okay.
How about the first pass effect?
The first pass effect happened for some drugs. This is one of the factors affecting the bioavailability, but it is not related to distribution of the drug. Here, the drug does not distribute it. The drug going to the portal circulation to the liver, and liver may destroy some parts of the drug according to this amount or this extent. Is it high or low? If it is high, the remaining amount that going back to the GIT in order to absorb is decreased, so that the bioavailability here will be affected and decreased. This is what happened with drug like nitroglycerin or nifedipine or lidocaine. Okay.
So if the statement which is about like the bioavailability affected by BD is a wrong statement, is it?
Yes, by volume of distribution is not affecting bioavailability at all. Let's see the last question today. The right site of action for the following drugs. Make a connection between the diuretic and its location of action. Furosemide in proximal tubule. Is it right or wrong? It is wrong. It is in loop, especially the ascending part of loop of health. Yes. Spironolactone in loop. Also, it is wrong. It is in collecting
and distal
duct.
duct. Mannitol in the glomerulus.
No.
Yes, it is right, but not only in glomerulus. It can act on all parts of the tubules. So it is not right. Thiazide in distal.
Yes.
Yes,
it's true.
What is the diuretic acting on the proximal? It is
Carbonic anhydrase.
carbonic anhydrase inhibitor. Yes, carbonic anhydrase inhibitor. Okay. This was the last question today. I hope this revision is or was useful for all of you. Still, we have another three free revisions each Sunday. Also,
may I
we
ask you a
still have.
question?
Okay, after I finish. Also, we will have the full revision that you can join it from this website or this link to join the full revision. Still, you have the ability to attend the full revision till the exam. Okay, the full revision for of another 4 complete lectures plus the mock test. I'd like to thank you so much, and now we can open the discussion. Okay.
So I have a question regarding the acetylation. If acetylation, what group should be present?
Acetylation doing what?
What are the groups that should be present in the
we add acetyl group. Acetylation means addition of acetyl group. So acetyl group is more lipophilic. So making the result or the product here more lipophilic. Here acetylation may extend the action of the compound. Like methylation may extend the action of the compound.
Sir, actually, we have the confusion, like you have told that for grouperization we have certain groups. So if any other question comes, then how can we recognize it that whether it is sulfation, acylation, or other reaction?
Okay.
Any tips for the groups and their reactions?
Okay. Here, for the metabolism, the drug may go through different reactions, not only one reaction. Okay, so that you will find some drugs like morphine will go through different types of reactions. you will have different metabolites of morphine. This happens. According to the affinity of the drug to the enzyme, this will affect. And also according to the amount of the enzyme. For the phase 1, oxidation is the most common reaction happened. For the phase 2, glucuronidation is the most common reaction happened. If we take a morphine as an example, which types of metabolic reactions happen to morphine? Morphine having different groups that can be metabolized by different reactions. It can be oxidized. It can be joined to sulfate or joined to glucuronic acid. Okay, so
Or even
all of them can happen. Also acetylation, yes, all of them can happen, but in which extent? Okay, you find that oxidation is the highest one, and then glucuronidation. But you will find some other metabolites, not only one metabolite. So according to the reaction and according to the question itself, asking about which drug and which group will be metabolized. Is it clear? So there is
Sir,
no one
have-
answer. There is no one
Okay.
answer. The answer is depending on the question itself, asking about what. Okay. In the previous question that we discussed today, here is a specific question for glucuronidation and which group does not affected by glucuronidation. It is alkene here.
Okay.
But if the question is general, he will not do that. He will not give you a question having 2 or 3 answers. For sure not. It will not happen.
Right.
So I want to ask, phenol is a tertiary or secondary alcohol? Can
It
you
is not.
show
It
us?
is not classified as a tertiary or secondary because here we have a different structure. So we cannot classify it as a tertiary or secondary or primary.
Is it because it is in the aromatic ring, so we
Yes, it
cannot
is in
classify
aromatic,
it?
so we cannot classify it as secondary or tertiary.
Only the one with
However, some textbooks classify it as secondary,
tertiary.
but
Secondary.
but some other textbooks saying that we cannot classify it.
But they are like some of the textbook with the question asking that if phenol can be prone to oxidation or not, something like that. Because if it is
Prone to
secondary, it will
dehydration. Prone to dehydration, will not dehydrate, will not oxidized. Will not oxidize. There is no H, there is no hydrogen in the carbon attached to the OH, so that there is no oxidation reaction happen to this phenol. As you
But
know, the
phenol will
phenol,
undergo
so this is the phenol. This is the carbon attached to the OH, right? This carbon having double bond and single to the other carbon and the bond to the oxygen. There is no hydrogen attached to this carbon. So there is no dehydrogenation or dehydration or oxidation.
So it's not prone to oxidation or
dehydration.
Dehydration. It won't prone to dehydration, right?
Yes, it is not. It is a wrong statement for this question.
Sir, I need to ask 2 questions, may I?
Yes, please.
Sir, there was a question regarding previous recalls that which one of the following drugs should not be used as an initial therapy for Parkinson's? And the options were like entacapone, levodopa, carbidopa, and there were like 2 more options. So, sir, what is the right option for this?
Entacapone. My question to you now, does entacapone a drug for Parkinson's or not?
So it's not directly related to Parkinson's,
and not indirectly also. Okay, we cannot use entacapone alone.
Yes,
it
sir.
will not do anything. It will not do anything for Parkinson's. It's just a guard for levodopa.
Levodopa,
And
yes.
we cannot use it with any other drug other than levodopa. Can you use entacapone plus amantadine?
No.
No.
use.
Can you use it with bromocriptine? No. It is
No.
only plus levodopa. It's like carbidopa. What about carbidopa?
Must be with
Should only be used
levodopa.
with levodopa.
Only used with levodopa. Can you use it alone? No. Like also the third one, silicyline. Can you use it for Parkinson's? Can you use it to treat Parkinson's alone? No. Can you use it with any other drug? Also no. So they are not indicated for Parkinson's. They are only used to protect levodopa. This is the specific action of them.
Okay, sir. Thank you. So my second question is, what is the
Okay.
drug of choice for pilots for motion sickness?
Motion sickness, yes. We have many drugs
Drug of
can be
choice.
used. We have many drugs can be used for motion sickness. You can use diphenhydramine, you can use other antihistaminics, you can use sometimes carbonic anhydrase inhibitor can be used according to the
But they
situation.
all have some sedative action. So in previous recalls, the option is like meclizine. So is it the right option?
Yes. Yes, according to the choices that present and according to the patient himself. Sometimes there is no problem with the sedating effect. And sometimes if he mentioned that, so you should take care about the sedating drug.
They're asking about the pilot. So pilot should not take the drugs which are drowsy.
Yes, yes.
So
Should not
meclizine
use
is
a
the
drug.
correct answer for
Should not
pilot?
use a drug that may cause sedation.
Yeah, yeah.
So if you have another option that will not cause sedation, this will be the right answer. So I told you, this depends on the choices and depends on the patient profile. There is no one answer for all questions. And mostly you should tailor the drug for the patient according to his situation. Okay.
So there was another question about the symptoms of abrupt discontinuation of amitriptyline. All were there except the options were runny nose, sleep disturbances, dry mouth, and abdominal cramps. I was confused that on abrupt discontinuation, the withdrawal symptoms appear means opposite to the effects of the drug.
Yes.
Please guide.
Opposite the effect of the drug. If the drug causing dryness of the body fluids, what will happen if we have withdrawal symptoms? The body fluids or the body secretions will increase. One of them is the nose secretion. So he will have a runny nose.
Right.
Okay. If the drug causing constipation, so what you will expect about this? If you stop the drug directly or suddenly, you will have a diarrhea. Okay. This happened with the drugs that may lead to withdrawal symptoms like opioids, like serotonin reuptake inhibitors. Also, some tricyclic antidepressant may lead to that. So, opposite the anticholinergic action of the
So it will be the abdominal cramps because it has alpha blocker activity also and anticholinergic as well. Then what is the right answer?
Abdominal cramps may happen also. Abdominal cramps may happen also. Runny nose may happen. Diarrhea may happen. So opposite all the actions.
Dry mouth, is it, sir?
Which
The
one?
discontinuation of the tricyclic antidepressant except dry mouth.
Dry mouth is one of the side effects or the effects of the drug. So salivation may happen.
But
because the question is about the symptoms of abrupt discontinuation of
Mhm.
tricyclic antidepressant, except
Except
means the dry mouth is not the symptoms
if there is
after
except, so choose any effect of the drug. If dry mouth is present, choose dry mouth. If abdominal cramp is present, so choose abdominal cramp.
Both options are available, abdominal cramps and dry mouth. I think dry mouth will be the right answer.
I don't see the question now
I will send you
in
this
front of me,
question again.
so you can send it to me again to see it and answer you. Okay, because sometimes you will find a word in the question that may direct you to the right answer. Okay,
Okay,
but
right. I will
unfortunately,
send you.
I don't remember the question now, and I don't see the full statement. You should mention the full statement, or should read the full statement carefully.
Sir, regarding the one Parkinson disease, because the question is about the following are appropriate for initiating the therapy for the Parkinson disease, except which one? There is an option of amantadine, entacapone, levodopa, carbidopa, and another one is pramipexole.
We just discussed it now. Entacapone is not used for Parkinson's. Even there is amantadine, which used not initially, but in comparison to entacapone, which one is used? Amantadine used for Parkinson's, while entacapone not used. Okay. Please leave others to ask. You take many chances for asking. So please.
Sir, my
I'm sorry
question
for that.
regarding
Mhm.
is sir, there's a creatinine clearance calculation in last exam. So, is there any specific changes in that calculation? Like, what it's just not entering the values in the formula, but there is some trick to solve that kind of questions. So, is
No.
there any question for practice or
It
something?
was a very easy question.
Yes, but sir, there's I saw in the KAPS group that there's a trick as well to solve that questions. According
No,
to
there
the
is no any trick for this question. It was a very easy question, direct question. You should use the right formula to solve it. Just using the right formula to solve it. Okay, just apply the formula and use the information that you have, then you'll get the answer directly without any tricks. This question have no any tricks at all.
Okay. So if the patient is female, that is just multiply by with 0.88, isn't it? That's it.
Yes, you should add this figure to the formula. If the patient is female, you should multiply the result by 0.85. Why this happened? Because the musculature of the female lesser than the musculature of the male. It is 85% of the musculature of the male. Therefore, we will get an 85% of the result. Therefore, we multiply by 0.85.
So there is nothing else. There's nothing else values or something trick in this kind of question. Just need to put the values in the formula, and if patient is female,
but
just multiply.
But not any formula. The right formula.
Formula.
Yes, we have two formulas for that, according to the unit of the serum create. Okay, refer to the formulas. We have two formulas. One of them related to the unit by milligram per deciliter, and the other related to the micromole per, I think, per milliliter. Okay, so we have two formulas. So use the right one in the solving of this question.
Okay, so there's a change of units. So according to the units, we have to use the correct formula and put the values in it. Okay.
Yes.
Thank you. Thank you.
So may I ask a question, please?
Yes, please.
There is a question related to milli-equivalents in calculations chapter of your first calculation chapter, the notes provided by you. So it asks that how many milli-equivalents of sodium are there in 92 milligrams of sodium chloride?
Yes.
So if we see there are 1 milli-equivalent of sodium in 58.5 milligram of sodium chloride. So how come there are 4 milliequivalents of sodium in 92 milligram of sodium chloride. Like why we are dividing the molecular weight with the
23,
the mass in grams divided by molecular weight of only sodium. Why we are not dividing it with the molecular weight of sodium chloride? When we see there are only 1 milliequivalents of sodium in 58.5 milligram of sodium chloride.
This is your question. Why we divide by 23 and not dividing by 58.5?
Exactly, sir.
Okay.
So
Here,
I was thinking like when there is 1 milliequivalent of sodium in 58.5 grams of sodium chloride, isn't it? So how come there are 4 milliequivalents of sodium in 92 milligram of sodium chloride?
Sodium chloride formed of how many molecules of sodium and how many molecules of chloride? 1 sodium and 1 chloride. Okay?
Okay, sir.
So we are calculating the sodium only. Sodium only equivalent to the number of sodium chloride. So if we have 2 sodium chloride, how many sodium present in it? 2 sodium. If we have 10 sodium chloride, how many sodium present in it? 10 sodium. Okay, so if we need to know the sodium only, we can divide this by the weight of sodium. Is it right?
No, sir, I'm saying like there is only 1 milliequivalent of sodium in 58.5 grams of sodium chloride. Am I right?
You say that 1
milliequivalent of sodium
milliequivalent of sodium
is in 58.5 grams or milligrams of sodium chloride.
The comparison is not equal here. You should make the comparison by the same units. 23 milligrams of sodium present in 58.5 milligrams of sodium chloride. This is the right statement.
Yes.
Okay, so the comparison here is not applicable because here we have a milligram and here we have milliequivalents. We should convert this into weight. How can we convert it into weight? By dividing over the molecular weight of sodium itself. Is it clear now, or still you have a confusion about this?
So this will be divided by 23.
Yes.
Then again, we get 1 milliequivalent of sodium is in 58.5 milligrams of sodium chloride.
Okay, so the division is by the molecule of sodium alone, because we need to know the weight of sodium alone. Okay?
Okay, sir. Thank you very much.
You're welcome. What else? Do you have any other questions? Evelyn, do you have any question? I'm sorry for stopping you, but to give the chance for others, if you have any other question, please ask.
Yes, please.
Yes.
I was wondering about carbonic anhydrous. Does it have an effect on alkalosis, acidosis?
Carbonic anhydrase inhibitor will cause metabolic acidosis. It will cause metabolic acidosis. Why metabolic acidosis happened here? Because carbonic anhydrase inhibitor increase excretion of bicarbonate. Okay, by increasing the excretion, its level in the blood will decrease the level of bicarbonate in the blood. Bicarbonate is a basic or alkaline compound, leading to what? Decrease the acidity, decrease the viscosity of the blood, or increasing the acidity of the blood, so that metabolic acidosis happens.
Okay. Thank you.
Okay. So I'd like to thank you so much and see you in the coming revision. Goodbye.